Hi, everyone. My name is Dr. Orlando Harris. I'm an associate professor of nursing and medicine here at the University of California, San Francisco, and one of the co-directors of the California Center for HIV Syndemic Policy Research. I want to make the case that everyone experienced loneliness and isolation at some point. This is not an issue that's specific to Black and brown sexual minority men. The interesting thing, though, is when one experiences loneliness and they're isolated, but speaking specifically about loneliness, what do? How do you cope? What's healthy coping? And so those are some of the things that we're starting to look at from the data, but also to make some recommendations. So for example, if you're experiencing loneliness, I want to make clear, though, that there is a difference between loneliness and wanting to be alone. And not everyone who wants to be alone is experiencing loneliness. And so oftentimes people get those two things confused. So if you're experiencing loneliness, there are a couple of things you can do. One, reach out to your local communities in the area or local organizations in your community. For example, maybe there's an LGBTQI+ center that you can reach out to that has resources available to get you connected or might have support groups available. I'll say reach out to friends within your own network. You'll be surprised how many friends, once you bring up the topic of loneliness and isolation, how many of your friends start voicing their own experiences with loneliness. One example I can think of, I was having this conversation over the weekend with a gentleman who explained to me that he had lost his dad very young. He was 15 years old. His father was about 45 thereabouts. And he said, I watched my mom battle loneliness and become a husk of her former self. And that was hard for me to see her just become so lonely and experiencing that level of loneliness. And he said, over time, I've seen my mom, she's dating again. She's finally started seeing someone, and I'm starting to see that person I knew when I was 15. And so that's one example of that everyone can experience this. You can also be in a marriage for 20 years and experience loneliness, right? What I would suggest that folks do is to find other ways to build a community, to reach out to social support systems, your own friends, your individual network, and because it's Mental Health Awareness Month, see a therapist, talk to someone. You'll be surprised how many of your friends are also talking to someone or in therapy. And so I'll suggest those things as a start. And maybe from that connection with that therapist, you'll start to learn some more things about yourself and rediscover yourself. And that will help you to develop more healthy coping mechanisms.